How many of you look in the mirror and see what's unaffectionately called the muffin top? You know what I mean? That little excess bit of body fat that kind of sits above the waist of your pants or your jeans. Or do you spend the day trying to suck in that little pooch? Why am I saying this? What I'm doing is self-indictment right here. Sometimes diet and exercise cannot target those problem areas. My first guest can actually get rid of it by freezing it. Dr. Ann Therese Stubbs of Dr. Ann Therese Aesthetic Medicine is here to talk about Coolsculpting, and she brought along a patient, Hillary Cole. Welcome to both of you. Sadly, I know all these things that I just described, Dr. Ann.
I think every woman does, and a lot of men too.
And no matter how thin you are or how in shape you are, there is always places in our body that have just a little extra where we don't want it.
Exactly. Kind of problem areas, or we call them exercise-resistant areas.
Okay.
So even I'll have patients that are in great shape, they eat well, and they say, even when I'm at my thinnest, this is an area I can't get rid of. Some people, like Hillary, said to me, I've had this little pooch on my tummy since I was 13 years old. Hillary teaches dance. She's in fantastic shape. She's in her 20s, but just had a little area in her tummy that she could not get rid of. And she was a wonderful, wonderful candidate for Coolsculpting. And so she's kind of here to talk about her experience and tell us about her results.
Well, first, explain what it is. It almost sounds like a magic type wand.
It does. And I brought the wand.
You brought the wand?
Yes. So basically, it's just a little housing, and it sucks the fatty area right into this little plastic sheath here. It sucks the fat right into there. It looks like almost like a stick of butter, and it freezes it for 1 full hour. So the patient only feels a little tugging sensation, and then maybe a little bit of cold, and then it's numb. So they just basically sit, lay there, sleep, or read a book, or bring their computer and just sit in that position for an hour while the fat cell is frozen. When the fat cell hits 31 degrees Fahrenheit in the body, it breaks open. So any cell that lyses or breaks open in the body is naturally cleared by the body in the next 2 to 3 months. So basically, it's a non-invasive procedure. It's just frozen for about an hour. The patient can leave the office with a little bit of maybe numbness over the area, and then over the next 2 to 3 months, that area of fat dissipates on its own. The body just clears it.
Wow. Hillary, I have to say that it's a bit intimidating looking, but we saw the picture too, and it does not hurt, feel uncomfortable, or any of those things.
Not at all. You have a little bit of discomfort maybe coming off, but so mild, it lasts maybe 2 minutes and you're done. It's phenomenal. It's done wonders for me.
Well, pictures show the story. And so we're going to show before and after pictures of you. And I will have to say that, yes, you are in phenomenal shape, but I could tell the difference after you went through the Coolsculptor.
Absolutely. I've always had that stubborn belly fat, and I felt like there was nothing I could do to help it. I would work out, I would eat right, and it would always be there. So Coolsculpting was the answer for me.
So we're looking at the before, so let's take a look at the after. And oh my gosh, it's gone.
Big difference, huh? And I noticed a difference as well as people around me. I'm down a full pant size. I've lost inches around my waist. It's just made all the difference in the world. And now I'm on top of working out. It almost gave me a push to do better. I want to eat healthier. I want to work out more to maintain what I've gotten from Coolsculpting.
Now, Dr. Ann said it takes a few months to actually get through the body. So how long until you saw results?
I'm actually 3 months out last week, and I've seen fabulous results. I started seeing them about a month out, and they've just gotten better and better as time goes on.
Now, Dr. Ann, will the fat come back in this area to people like Hillary or anywhere where you use this device?
Well, that's a great question, because I have a lot of patients who come in and say, well, I've heard it will travel somewhere else. Nothing travels.
The fat will travel.
It doesn't travel. What happens is we don't make new fat cells as adults. So we have the ones that we have in adulthood, and we can expand and contract them by what we eat and how much weight we gain. So the fat cells that are killed off by liposuction or by Coolsculpting will never come back in that area. Now, I tell my patients, if you go home and go on the Krispy Kreme diet and gain 50 pounds, you will gain weight a lot of different places. If the belly or the love handles or bra fat was where you used to gain it preferentially, those fat cells are now gone, or at least 40% of them after one treatment, and so you won't gain as much weight there, but that you gain weight just everywhere in your body. So it doesn't prevent you from ever gaining weight, but if people don't change too much about the way they eat or exercise, if they're on a kind of an even pattern as it is, they don't tend to get that pouch back at all.
That is so, it's
permanent.
Fascinating.
It is. It's fascinating too that men are a little more intrigued by it too, because it's not only women. Men will sometimes think, an hour and I could get rid of that little
And they won't talk about it, but they'll do that.
Exactly.
Right,
we all talk about it.
Dr. Ann, thank you. And Hillary, thank you for sharing the story.
Thank you.
Thanks for having us.